Hello all, welcome to Know Your Medicine, an initiative by Librate, your personalized health companion. In this video, we are going to discuss about Sompraz D Capsule SR. We will be discussing elements like why it is used, to whom it is prescribed, its consumption and various side effects. Before starting with the theory, let me tell you a brief about this tablet. Sompraz D Capsule SR is a part of the dopamine antagonist group of drugs which prevents the tendency of vomiting and nausea in people suffering from gastrointestinal problems and also those who take certain medicines for Parkinson's disease. Sompraz D Capsule SR attaches to the dopaminergic receptors without causing any release of the chemical dopamine. The medication works by emptying your stomach quickly, reducing nausea. It also reduces stimulation in the part of the brain called the vomiting center. Sompraz D Capsule SR is used to treat nausea and vomiting. It is also used in the treatment of gastric motility disorders. The possible side effects of taking Sompraz D Capsule SR can be diarrhea, headache, migraine, dryness of the mouth, or breast pain. There are severe side effects too, which needs immediate medical treatments like irregularity in heartbeat, a feeling of dizziness, difficulty in breathing, swelling of the throat or the face, menstrual irregularities, discharge of breast milk, swelling of breast in males. The usual dose of Sompraz D40 Capsule SR is 10 mg, which is generally taken 15 to 30 minutes prior to your meals. The maximum dose that is recommended depends on the body weight, other medicines that you are currently taking, and your health condition. Warning: please do not take this medication without consulting your physician.